Measles is a virus transmitted by viral droplets such as sneezing, coughing, and you can even get it by people talking to you, especially if you're quite close to them. It is extremely infectious. It only takes one person to infect up to 20 people compared to COVID, which only takes one person to infect up to 3 people. And all you have to do is spend up to 15 minutes with that person in a closed environment, whether it's a classroom, train, bus, or even in your house. The incubation period for the measles virus is about 10 days, where it can be between anything from 7 days to 21 days. And it's about 4 days of flu-like symptoms before the rash actually appears. So a person with measles will be infectious from 4 days when the symptoms appear to 4 days after the rash disappears. Well, symptoms of measles, you can get the typical flu-like symptoms such as runny nose, blocked nose, cough, sneezing, mild or high fever, but in most cases your high fever can be up to 40 degrees centigrade. Now the 3 important features for measles to look out for would be conjunctivitis, which is when you get sticky, gunky, yellow discharge in one or both eyes, Koplik spots, which are like the small white spots in the cheek and within the gums, and a characteristic measles rash, which is a non-itchy red rash that starts from the face, behind the ears, and then spreads downwards to the trunk and other parts of the body. Now, everyone is prone to measles, whether you're a child, teenager, young adult. So if you suspect measles and you've been in contact with someone who's had measles, you need to isolate yourself, as well as your child, and inform the Health Protection Agency, as they will need to do contact tracing of people you've been in close contact with over the last few days, and they will usually send to you a PCR test kit, which is usually a throat swab used for testing the oral fluid. So similar to when you tested for COVID, the throat swab is usually used to test both cheeks and then sent back to the Health Protection Agency. And remember, the isolation period is at least 4 days after the rash has appeared or until you have fully recovered. If you're pregnant or high risk and you've been exposed possibly to measles, then as prevention management after exposure, the health protection team will arrange for you to have IV immunoglobulin, which is usually done after they've tested for immunity to measles. And this should ideally be given 72 hours after post-exposure, but can be given for up to 6 days after exposure. Now, the treatment for measles is as you would treat any virus, because the virus itself is self-limiting, so you need plenty of rest, you need to drink plenty of fluids, take paracetamol for your high fever. For the conjunctivitis, just clean the eye with cool boiled water. The rash is usually non-itchy, so there's no treatment for the rash. You can just apply your usual moisturizing creams if it's a bit dry. However, if you are immunosuppressed, whether you're someone who's on chemotherapy or you've got a condition or medications that will make you more liable to get other infections, then you're most likely to again get IV immunoglobulin treatment. In terms of prevention, you need 2 doses of the MMR vaccine to offer lifelong protection from measles. It is important to try and prevent from measles because anyone who gets measles, and if you're immunocompromised, you're at high risk of complications such as pneumonia, meningitis, encephalitis, deafness, blindness, seizures, and if you're pregnant, you're at risk of miscarriages, premature birth, stillbirths. So if you're someone who missed out on childhood vaccinations, it's never too late to be vaccinated. Now, I hope this video has given you more understanding about measles, how to recognize measles, and what to do if you suspect or if you've got measles.